نبدأ بعون الله في هذا الصباح محاضرة which is regarding about homeostasis. Okay, من يقدر يقول لنا what is homeostasis؟ طيب what is homeostasis؟
homeostasis الاتزان.
ممتاز، الاتزان في نواحي فسيولوجية مختلفة. طيب هيمو is blood صح؟ فلما نقول homeostasis together it's going to be the process of
clotting,
stopping the bleeding. Okay, it's simply stopping the loss of blood. So you know the difference between homeostasis and hemostasis. So in this lecture we're going to discuss several topics. We'll start by the structure of the platelets, which is the thrombocytes, and how it's produced in the body, and then its structure and its function. Then the process of hemostasis itself, it has 5 different steps. Each steps have several details. And then so hemostasis is the stoppage of bleeding. Okay, and then if clotting happen, okay, there is anti-clotting mechanism naturally in the body. Okay, and also when there is disorders, either bleeding or increased coagulation. So we're gonna gently touch on that. Okay, so and I'm sure you will get more details in your pathology lectures. And then also the most famous 2 drugs used in these disorders. Okay, we'll start by the thrombocytes, which is the platelets. It's a small cells. Its diameter range from 2 to 4 micrometer. Structurally, it's granulated cells, okay, but does not have a nucleus. The normal count is ranging from 150 to 450,000 cubic millimeter. It's formed from what? The megakaryocytes. So this is the megakaryocytes. The pinching out of it is will make the this cytoplasm will make. سوري تشوف المؤشر صحيح؟ المؤشر لما أحرك يوضح لكم؟
لا
هنا
لا،
شايفينه على السن؟ مو واضح؟
لا مو واضح.
دقيقة. طيب كده واضح؟ الخطوط الحمراء اللي بحطها هذه تمام ممتاز.
واضحة.
طيب this is the megakaryocyte cell. So the platelet is a result of pinching out of this cytoplasm of the megakaryocyte will make thousands and thousands of platelets cells from one single megakaryocyte. Okay, and mostly it's circulating in the blood, and some of it will be in the spleen. The lifespan is short lifespan compared to the RBCs. What's the lifespan of RBCs?
120 days.
Excellent. So platelets only 7 to 12 days. Okay, and how it's distracted and eliminated from the circulation by macrophages, mostly in the spleen. Okay. The thrombocytes need this thrombopoietin, which is a regulator of the production of thrombocytes, is mainly secreted from the liver. Okay, we need this thrombopoietin to be binding to the receptor of the thrombopoietin receptors on the megakaryocyte cells, and this will make intracellular signaling until the megakaryocyte will increase the production of platelet. And as I said in the previous slide, one megakaryocyte cell can make thousands of platelet cells. But when the platelet cells is low in the circulation, then less of thrombopoietin is bound. Then we need more thrombopoietin available to be binding to this receptor and starting the production of the platelets. This is the structure of the thrombocytes. Okay, we have two structures: the cell membrane itself. Okay, the cell membrane and the cytoplasm. Sorry,
تعتقد
ماني سامعة.
لا واضح صوتك دكتورة.
معلش ماني سامعتكم.
واضح دكتورة، ما في شيء، معلش كم.
الصوت كان فيه تقطيع؟
لا ما في.
لا
تمام. اوكي. طيب كنا بنتكلم بنقول انه platelets the structure we have the cell membrane and we have the cytoplasm. The cell membrane we have the external layer, which is the exterior coat, and phospholipid layer in between, and there is also microtubules extending through the cell membrane, okay, which is open. It's open. It's called open canalicular system. It has function. We will discuss it in the coming slide. And in the cytoplasm, we have the granules, which is dense and alpha granules. This is the alpha granule, and this is the dense granule. We have also mitochondria, endoplasmic reticulum, Golgi apparatus, endosomes, lysosomes. This is most of the organelles found in different living cells. Okay, what is the function of this structure we discussed? So in the cell membrane, the exterior coat is important to maintain the structure of the cell, okay, and also interact with different ligands, like always something will bind, there is receptor, whatever, okay, but the receptors here we have specific to the platelets, which is what? Collagen, Volvibrand, okay, and fibrinogen. This is a specific regulator. When any injury happens to the blood vessels, it will release some factors, and then the platelet will be attracted to the site of the injury, and it will bind through these receptors. Okay, the phospholipid membrane, again, it has the arachidonic acid, which is responsible for the prostaglandin. Prostaglandin has important function here in this process in hemostasis. It's prevent the adhesion of platelets. So normally we should not have platelet adhesion, because platelet adhesion will lead to formation of platelet plaque, and it's without having an injury, we should not have this process happening. So the prostaglandin is released from the wall of the vessels, so it will prevent the platelet aggregation and activation. Platelet factor also, the opposite, it will enhance the coagulation or the clotting. Cyclic AMP, it will inhibit. So you find some structures will enhance and some structures will inhibit. The open canalicular system, it's important because it will release the granules to the external environment, and also the opposite. So, and when the platelet activation happen, when this platelet get activated, it will form pseudopods. Okay, and this external canalicular system, it will help and facilitate the formation of this pseudopods when the platelet get activation. There is also, like, under the membrane, there's microtubules, as you see in here, passing through the uh, uh, cell membrane. There is and the microfilament itself contains some structures like myosin and actin. This will form the skeleton of the cell itself, and it will help also during the platelet activation and platelet contraction or the clot retraction. Later we will have it in details. Okay, this is generally regarding the cell membrane. Now we're coming to the cytoplasm. There is important, which is the alpha granules and the dense granules. Alpha granules are protein structures, okay? For example, the fibrinogen, which is very important in the process of hemostasis, and this one will brand factors, some clotting factors, okay? And growth factors, such as the platelet-derived growth factors, all essential to the process of coagulation. Dense granules is non-protein, okay, such as serotonin, calcium, and ADP, all essential for the either activation of the platelets or the clotting process. What's important about endoplasmic reticulum, it will secrete calcium, essential for this process. We speak previously about prostaglandin and the thromboxane A2, also essential for the activation of the platelets. Mitochondria, important for the energy. Lysosome, it will digest. So it's the final process when we need digestion of the clotting, the clot itself, which is called fibrinolysis. Okay, this is enough regarding the structure of the cell. What is the function of the platelet? It will maintain the hemostasis. Now, what is the hemostasis? Is the process of formation of clot in the wall of a damaged blood vessels and to prevent the blood loss. What is the steps or mechanisms happen in this hemostasis? It's 5 steps. First, the first response of the vessel wall to the injury is by doing the contraction. So vascular constriction will happen at the site of the injury as an initial step trying to stop this bleeding. Okay. Second step is formation of platelet plug. Platelet plug, from the name, it's a process of activation of the platelets. But platelet is a small cell, it's a very fragile. Even if it's forming a plug, it's not strong as the blood clot. Okay, so platelet plug is like a stage in between. Okay, it will stop the blood temporarily, but if you press anymore or anything happen to the site of the injury, it will bleed again. Then we need a stronger form, which is the blood clot, is the third step in this hemostasis process. Okay, which is called also blood coagulation. Don't get confused if I said clotting or coagulation, you think it's different process. It's the same process. Okay, and then when we form the blood clot, you're injured, you have now a blood clot. It will stay the same or it will get smaller and smaller with time.
It will get smaller.
Excellent. It will get smaller with time, so we need this retraction of the clot and also the wound healing, okay? And at the end, the complete digestion of this clot by fibrinolysis. Remember, we have 5 steps in this hemostasis. We're gonna discuss it in detail in the coming slides. Okay, so this is the platelet function, is maintaining of hemostasis, but also it's it has a crucial role in the tissue growth. We have the platelet-derived growth factor, and also in the process of inflammation. Inflammation, when it happens in one place, it will attract so many different molecules. One of it is the platelet, and also it can be involved in the immune response. Okay, we're coming now to the first step in hemostasis, which we said earlier is the vascular constriction. Spasm happen at the site of the injury. A minute. So at the site of the injury, here we have injury. So what will happen at the time of injury? There is local myogenic spasm in the muscle. The smooth muscle will first response by myogenic spasm in the smooth muscle, trying to reduce the amount of blood loss. Okay. Again, in the same place, we have always the nociceptors, the receptors for pain, and also it will make a nerve reflex, okay, to trying to minimize the site of injury. There is also chemical attraction for some factors, such as here we have the blood vessel is smooth muscle cells, and what is this? The lining of the blood vessel itself, what is called?
Endothelium.
Endothelium.
Excellent. The endothelium. The endothelium, we have the endothelin, we have the thromboxane A2 and serotonin. All of these factors, when the injury happen in the endothelium, it will attract the chemical factors trying to do the vascular constriction, okay, which is a first step trying to reduce the blood loss in the site of injury. So this is the first step, is the vascular constriction. Second step, what is it? Formation of platelet plug. And also remember, when you have the hematology lab, there is a blood test for this formation of platelet plug, and other tests for the clot formation. Okay, so we come to it, discuss it at near the end of the lecture. Okay, then after the vascular spasm, okay, the formation of platelet plug, then we come to the process of platelet activation. First response of the platelet when become recruited is to be swollen and then form some pseudopods here, okay, forming pseudopods to become what? To become sticky, okay, and they can adhere to each other and to the site of injury as a first trial of stoppage of the bleeding. So here at the surface of the platelet, we have this glycoprotein, okay, glycoprotein, it will let it become sticky, adhere to collagen in the tissue, and protein called von Willebrand factor, which is available at the endothelium part, okay, and it will bind together and stick to the site of injury. Then the platelet itself, it has some contractile protein that contract and then cause the granules to release these granules, okay, which is the ADP, thromboxane A2, attract more activation of more platelet to become and start the process again, stick to each other, and to form a platelet plug in the site of injury and stop the bleeding. So this is the process of platelet activation, okay, to form the platelet plug. This is the second step in hemostasis. Okay, this is the glycoprotein receptor that bind to the von Willebrand factor that's available in the endothelium. And these are the factors that are released, which is ADP, platelet activating factor, and thromboxane A2. Thromboxane A2 activates and recruits more platelets to become an aggregate and then formation of the platelet plug. Okay, but as we said, this plug is loose, so we need something more robust, which is the blood clot. This is another illustration of the same process, but here I will add normal endothelium. As I said earlier, it secretes the prostacyclin and nitric oxide, okay, to prevent the platelet aggregation. So if there is normal endothelium, no injury, we do not need these platelets, okay? So what is the response of the normal endothelium is continuous secretion of nitric oxide and prostacyclin. So there is no activation of the platelet. When there is injury, same process I explained earlier will happen. Why? Because the collagen is exposed, okay? And this will attract the platelet to come and stick to the site of injury and form the platelet plug. Okay, then we come to the third step, which is the blood coagulation or blood clotting, formation of the blood clot. Okay, we need the blood clot, that means fibrin, okay? There's platelet, there's RBCs, and there is fibrin thread, okay? In between to form the blood clot. So it involves a cascade of reactions. The main reaction is conversion of fibrinogen to fibrin threads, okay? And the main result will get the blood clot. Anything activating this coagulation is called procoagulant. Anything against this coagulation is called anticoagulant. This is the clotting factors you need to know. Mainly, it's used as Roman numbers. You do not need to memorize the names. Mainly, especially the most important two is fibrinogen and the prothrombin. Okay, but you need to know the numbers. You need to know where it's coming in the pathway. I will explain later. Okay. Try to know how this Roman numerical works. I think it's easy, but this slide will help you if you're not sure about it. We said the most important two is fibrinogen and prothrombin. Why for example, fibrinogen is number one, prothrombin is number two? This is this it's not about their order in the pathway, no. It's about the order of their discovery. So the first one was discovered, this is important. The most important one is just fibrinogen. Then they know the prothrombin, then the tissue factor get number three, and etc. But it has no relation with where its position in the pathway here, okay? The process of blood coagulation, it's important three steps. It's a cascade of chemical reaction occurs until the coagulation happened, okay? The main result is formation of prothrombin activator complex. Remember this name, prothrombin activator complex. What is the prothrombin activator complex? It's factor 10, factor 5, okay, and this platelet phospholipid and calcium. These prothrombin activator complex will result in the formation of prothrombin. It will be activated to form the thrombin. With the help of calcium, fibrinogen will be converted to fibrin. This is the most important step in this cascade, okay? Prothrombin to thrombin, then fibrinogen to fibrin by the help of prothrombin activator complex. Okay, so the prothrombin activator catalyzes the conversion of prothrombin to thrombin, and then thrombin acts as an enzyme to convert the soluble fibrinogen to fibrin fibers. These are the three important steps you need to know about blood coagulation. Yes, of course, you need to know the pathway, okay? But this is the most important step in the pathway, okay? The main result happened because of the prothrombin activator complex. Okay, before this, we have two pathways, either intrinsic or extrinsic pathway. Okay, and then both of them will result in prothrombin activator complex. After this reaction is called the common pathway. I know it's confusing. I will come to it step by step now. Okay, this is our focus, is factor 10. Extrinsic pathway. Extrinsic pathway, from the name, it's extrinsic, so something external, it's a tissue. There is a tissue involved, okay? So it happens only inside the body, okay? A quick one, you see, it's only two reactions before it's coming to the common pathway. We will see now a comparison between extrinsic and extrinsic. But here it happened only inside the body because here it will form the tissue factor will activate factor 7, okay, to its active form with help of calcium, and also again tissue factor, okay. Tissue factor is found only inside the body, so it's gonna happen inside the body but not outside. This will activate factor number 10. Okay, and then we come to the prothrombin complex, and then the common reaction happens. This is the extrinsic pathway. It's mainly, as I said, it's happened only inside the body because it has external factor, which is the tissue. Intrinsic pathway, main pathway, it happened inside and outside the body. Why outside the body we need hemostasis? Or give me an example of, a blood injury happen outside the body. For example, if I have blood in a test tube, okay, test tube is a plain test tube. So you think there is reaction is gonna happen here to the cells?
Yeah.
It's
No.
floating.
في أحد قال كلمة؟ ارفعي صوتك بس ما سمعتك كويس. اللي قالت كلوتينج ايش؟
حسب floating للسيلز.
حيصير كلوتينج للسيلز، ممتاز. طيب متى ما حيصير كلوتينج للسيلز؟ في التست
إذا
تيوب؟
حطيت أنتي كواجولنت.
ممتاز، إذا كان موجود أنتي كواجولانت. يعني أنا أبغى الكلوتينج يحصل، حاخذ تست تيوب بلين تست تيوب without anticoagulant, then the clotting will happen. Okay, this is an example of outside clotting. Do you think extrinsic pathway will happen in the test tube?
لا.
No. لا، عشان نحتاج tissue factor.
ممتاز، نحتاج tissue factor. Okay, عرفت الفرق؟ الintrinsic pathway it can happen both inside out and outside. اوكي اللي مهم تفهموه في كل pathway وتحفظوه اللي هو الفاكتورز. Here in extrinsic pathway we have 7 and 10 only. Here in the intrinsic pathway we have what? 12. We have 11. We have 7. We have 10. This is 8 is the activator of 7. This is 7 or 9? I get confused. This is 9, sorry. This is 9. Okay. So you need to remember the factors in each pathway. So in extrinsic pathway, we have 7 and 10. In intrinsic pathway, we have 12, 11, 9, 8, and 10. واضح؟ وزي ما تكلمنا في الفرق بينهم. Most all the steps need calcium except what? The first two in the intrinsic pathway. So calcium is essential for this process to happen. Okay. زي ما قلنا here we need tissue factor, here we don't. Then the main result will get the prothrombin activator, which is factor 10, factor 5, phospholipid, platelet phospholipid, and calcium. Then this will result in conversion of prothrombin to thrombin. Thrombin will convert the soluble fibrinogen to fibrin threads. كده انتهى الكواجوليشن تتوقعوا؟ بقى عندي آخر ستيب اللي هي فاكتور 13 اللي اكتشف مؤخرا، عشان كده هو كان هو الأخير. Need activation to form the fibrin clot. It will stabilize. Okay, هنا yes we have the clot, but it's not stable clot. Factor 13, it will stabilize the clot. Okay, make it more stronger. Okay, and it's very essential for the stabilization of this clot. أتمنى أن الموضوع يكون واضح بالنسبة لكم. يعني I know it's confusing, but try to take it step by step. Okay. This is stem reaction, prothrombin complex leading to this factors. This is the extrinsic pathway. This is the intrinsic pathway, and the factors involved. You need to know it in each pathway. This is a comparison between it. We said intrinsic pathway only, extrinsic pathway, what? Inside the blood vessels. Here, there is external services. The factors involved in each, we have mentioned this. Here it can happen inside and outside the body. This is only inside the body. Duration, this one is longer because it's taken time. So it's 2 minutes, while this one is a rapid 30-second one. Intrinsic pathway, it will form a definite clot, while extrinsic pathway, it lead to formation of the thrombin. So it's mainly why we have this extrinsic pathway to assist the intrinsic pathway and to lead to formation of quicker way to form thrombin, okay? But it will not lead to formation of a definite clot as we have in the intrinsic pathway. So the clot will be large and firm, here small and weak. There's always interaction between two pathways. There is not only extrinsic and intrinsic. There is in the body, there is also both pathways interacting together for effective hemostasis. Okay. The fourth step, we said the first step is the spasm. Okay. Second step, platelet plug. Third step is the clot formation. Fourth step is the clot retraction and wound healing. Okay, the platelet, of course, contribute to this clot contraction by the contractile protein. When we speak about the platelet structure, we said it has contractile proteins such as the actin and myosin and thrombocytin. All of this will help now in the fibrosis happening in the clot. As I said, calcium is essential for this process, and also factor 13. Okay, it will stabilize the clot. The clot usually formation, and then it will be retracted within 24 hours, okay, it will get smaller in size. This distraction make the clot more dense, more strong, okay? The edges will be pulled together of the injured vessels, so this will stop the bleeding definitely. Important factor is the platelet-derived growth factor secreted from the platelets. It will help in this process and fibrosis of the blood clot. Very important other factor, growth factor, which is the vascular endothelial growth factor. This growth factor from the endothelium, okay? It's important in the process of angiogenesis. What is angiogenesis? Formation of new blood vessels, okay, for the new site to be regenerated again if it has micro capillaries. Vascular endothelial growth factor is essential for this process. So here we mentioned we need the contractile protein inside the platelets, we need the calcium, we need factor 13 to stabilize the clot, we need the platelet-derived growth factor and the vascular endothelial growth factor. And actually, this one is one of the hot topic of research recently, okay? In many fields, for example, insulin resistant, regeneration of the process of angiogenesis, a regeneration of new blood vessels, atherosclerosis. It's yes, area of research. It's still not fully completely understood. Okay, here we come to the difference between serum and plasma. Plasma, what is plasma? Okay, if I have test tube, then I have whole blood here, okay? I put the blood, after a while, what will happen? The blood will separate. The blood will form a clot because there's no anti-clotting here, okay? And there is a clear fluid will be on the top. This is called serum, okay? So serum is the plasma minus the clot, okay? We have the plasma, but after the clotting is happening, then we have the serum. So the serum will be cleared from the clotting factors, while the plasma will have the clotting factors. If we need plasma, then we are going to use anticoagulant, and then we separate the blood. Okay, we put it in a centrifuge to separate the blood from the plasma. Okay, so the difference between plasma and serum, plasma will have the clotting factors, serum without clotting factors. Why? Because it's used here to form the blood clot. Okay, clear now? Okay, last and final step for hemostasis is fibrinolysis. معلش عذرا. Okay, final step is fibrinolysis. What will happen? When the clot is formed, plasminogen, okay, it's trapped inside the clot. with the plasma protein. When the injured vessel, the vascular endothelium will release the plasminogen activator, okay, which will activate and it will form the plasmin, will form the fibrinolysin. It's a proteolytic enzyme, the plasmin, which will digest the fibrin threads inside the clot, and it will do the fibrinolysis. As you see, this process, the plasminogen will be converted to plasmin by the help of the tissue plasminogen activator, thrombin, factor 12, streptokinase, urokinase. Okay, when we form the plasmin, this will lead to conversion of fibrinogen to fibrin. When fibrin degraded, this will lead to formation of fibrin degradation products, and this will end the process of fibrinolysis. Why it's important? Is it safe to have a blood clot inside the blood?
No.
Okay, then this is why we need the fibrinolysis step. Okay, it will help in reopening of the blood vessel. It will also remove any blood clots around. Okay, sometimes when there is sluggish blood flow, okay, blood clots will be formed. Then the fibrinolysis will lead to this process. And other stuff also, we need this fibrinolysis. For example, the semen liquefaction. ضروري دقيقة. Okay, we said other processes we need this fibrinolysis for the semen to keep the semen always liquid, menstrual blood, okay, to prevent this clotting happening, and the CSF again, this happen fibrinolysis. Some other serous fluid in the body, such as the pleura, which is around the lungs, and the pericardium. Okay, and now we finished the 5 steps of hemostasis. As we explained earlier, calcium has an essential role for this process to happen, both intrinsic and extrinsic pathways, but only the first 2 steps, and the intrinsic pathway does not need calcium. Okay, absence of calcium, this pathway will not occur. In living body, I mean, if the calcium concentration falls too low to this level, it's rarely will happen. And before we have affection of the clotting, it's incompatible with life. So fetal tetany can happen before, I mean, it affecting the blood clotting. So calcium should not be a problem. Okay, this mechanism between clotting and anti-clotting should be maintained, okay, equilibrium between them. So in order to have like a normal clotting mechanism. If any factors is getting more, for example, we have more procoagulants, then clotting will happen. More anticoagulant, then bleeding will happen, okay? So anticoagulation which is the opposite of what we said before. We were explaining the clotting. We need a clot to stop the bleeding. Now the opposite is anti-clotting. What is natural anti-clotting mechanisms available in the body? Antithrombin 3, plasmin, continuous blood flow, and heparin. These are different factors that will help maintaining the fluidity of the blood. First factor, antithrombin 3, is a protease inhibitor secreted from the liver, okay? It's essential to help the heparin block the action of thrombin and these clotting factors. Okay, so it's a natural anticoagulant available in the body and is produced from the liver. You see, the liver here is essential for the clotting. For normal clotting and anti-clotting, liver is essential. So the question is, if liver disease happen, what you are expecting? We will see this later, inshallah. Then plasmin, we explained plasmin in the previous slide. We said it's essential for the lysis of the fibrin threads, okay, for the fibrinolysis, and it will lead to the degradation products, fibrin degradation products in the circulation. Okay, plasmin will digest the protein coagulant. All these coagulant, it can be digested by the plasmin and by the help of tissue plasminogen activator, okay, which is the reaction explained earlier. The continuous blood flow, continuous non-sluggish smooth blood flow, this is one of the body mechanism to prevent platelet aggregation. If there is any, for example, thrombus, for example, this is the vessel wall, there's any thrombus, any like atherosclerosis, lipid, all of this will not make the blood flow easier and more smooth, and this will lead to attraction of platelets and coagulation will happen. So one of the body mechanism is the continuous blood flow will maintain the anti-clotting. Heparin, yes, it's produced naturally in the body, secreted from the mast cells and basophils. Okay, this is, we said it's a blood-related mechanism from the blood itself. Here we have from the endothelium, okay? Endothelium, what we should have in the endothelium, it should be smooth, okay? As I said earlier, it will, anything will attract the platelet and will start the coagulation process. So smooth surface, that means no activation of the intrinsic pathway. Okay. Thrombomodulin. This thrombomodulin is secreted from the endothelial cells and it will bind to what? To the thrombin, forming this complex, so thrombomodulin thrombin complex, which will activate what? Protein C and protein S. Okay, and this will inactivate when we said we need the active factors, for example, factor 8 and factor 5. This will inactivate these factors and lead to formation of plasmin. So this will prevent the clotting mechanism. Okay, it will inactivate the clotting factor and it will form the anticoagulant mechanism from the endothelium. So endothelium should be smooth. We have the thrombomodulin, okay? It will form the plasmin, which is a natural anticoagulant. Glycocalyx, mucopolysaccharides, negatively charged rebel clotting factors secreted from the endothelium. Prostacyclin and nitric oxide at the start, if you remember, I said the endothelium always will secrete prostacyclin and nitric oxide to prevent platelet activation. So the platelet aggregation will not happen naturally unless if it's needed, if there is a blood vessel injury. Okay, then this slide, heparin and warfarin. This is the anticoagulant, the most important ones. You need to know by heart. From now, you're at year 2 until you graduate, and after you'll be always asked what's the difference between heparin and warfarin. This topic is going to be discussed, I think, in details in your pharmacology lecture, but here I will just give you a brief hint about it. So heparin is a high molecular weight mucopolysaccharide. It binds to these antithrombin and these factors. Okay, you need to know the factors involved in heparin mechanism of action. It inhibits what? Activation of the stabilizing factor. Last factor I mentioned, stabilizing factor, factor 13, heparin will inhibit that. Therefore, this will give its anticoagulant effect. So the fibrin will be unstable. Okay, it's the pathway mainly what? Intrinsic pathway. Heparin will work on the intrinsic pathway. It's fast action. Okay, for example, in the case of DVT, and they will give heparin as a start, and then they will continue with warfarin. So it's fast and short duration of action from 4 to 6 hours. It does not cross placenta, so it's safe in case of pregnancy and also in lactation. How to monitor? This is very important. For heparin, we monitor by activated partial thromboplastin time. Okay, we will see here in warfarin what is it. Less drug interaction compared to warfarin. It's used to initiate the therapy, to start the therapy. For example, in case of MI, DVT, or pulmonary embolism, we start first by heparin. In case of overdose or whatever, how to reverse the action? By giving the antidote. The antidote for heparin is protamine sulfate. This is regarding heparin. Regarding warfarin, warfarin is coumarin derivative, which is what? Antivitamin K. Okay, it will vitamin K antagonist. Vitamin K antagonist. Okay, it will inhibit vitamin K epoxide reductase enzyme, and it will affect these factors. Okay, 2, 7, 9, and 10 protein C and S. It will work mainly on the extrinsic pathway. It's a slow one. Okay, it will take around 12 hours to get the onset of action, and the duration for 3 or 6 days. Okay, it's teratogenic, should be avoided during pregnancy or lactation. It's measured, its effect monitored by BT and IRNR. It has many interactions. Okay, several drugs can affect the warfarin medication. Also, it's maintenance therapy. So we start by giving heparin, and then when the patient is discharged home, it will be discharged on warfarin. And the antidote for it is vitamin K, phytominidine. Okay, now we explain the normal physiology. Gently, we're gonna touch on abnormalities, okay? When there is disorder in the hemostasis, what will happen? Excessive bleeding, okay? If we cannot stop the bleeding, if cannot make the clot, then bleeding will happen, okay? Either by deficiency of the clotting factors or vitamin K. We said this is essential for the process of hemostasis. Hemophilia is another example of bleeding disorder happened due to lack of clotting factors, or there is platelet abnormalities. Okay, so these are the options when there is excessive bleeding, or the opposite is the thromboembolic condition. It's the opposite. It's hypercoagulable. There is lots of clotting. So it's a state of spontaneous formation of blood clot inside the blood vessels. Either too little clotting or too much clotting. Too little clotting, bleeding will happen. And we have some example. Or hypercoagulable, then clotting will happen. When there is decreased clotting factors, all clotting factors are formed by liver. So in case of liver disease, for example, if the patient have hepatitis, liver cirrhosis, what will happen? Increased tendency to develop bleeding. يعني من الحاجات المرة common إنكم تشوفوا مريض جاي بإبستاكسس ويكون عنده hepatitis. Why? Because he has a bleeding tendency. Okay? When the liver is affected, all the clotting factor formation is affected. Vitamin K deficiency. Vitamin K is essential. Why? Because it has the carboxylase, liver carboxylase. It will add the carboxyl group, okay, and it will affect all of these factors, which factor 7, 9, 10, protein C and S, okay, and then it will oxidize it to become inactive. Another enzyme it will activate, which is the epoxide reductase. The epoxide reductase will reduce the vitamin K to its active form. Okay, so we say vitamin K is essential. Okay, insufficiency in this vitamin will lead to serious bleeding disorders. So in case of vitamin K deficiency, a brief hint about vitamin K, synthesized where in the intestine by normal bacterial flora. Okay, so it's rarely get deficient because it's synthesized inside the body. But sometimes this happen in the newborns, or if there is like gastrointestinal problem or antibiotic abuse, this will destroy the intestinal flora and this will affect the vitamin K, the natural vitamin K inside the body. Okay, and sometimes it's resulted from poor absorption if there is GIT problem. Okay, or it's absorbed also by fat. So it's a fat soluble vitamin. Vitamin K deficiency also can result from liver failure. Okay, the bile is essential for absorption of fat soluble vitamins. If there's any problem with the bile, okay, then this will affect the absorption of vitamin K. So liver disease or bile problem, for example, bile stone that affect the bile secretion. This will affect the vitamin K secretion, and these patients will have more tendency to develop bleeding. Some medication also will affect the natural vitamin K, such as phenytoin, which is the anticonvulsant medication, coumarin, which is the vitamin K antagonist, that will decrease the vitamin K level. Vitamin K injected into a patient with liver disease, they have injectable vitamin K, or somebody going through, for example, duct in the bile, a stone in the bile duct. Before operation, we should give vitamin K because those patients have increased tendency to develop bleeding. Okay. Hemophilia is another example of bleeding disorder resulting from what? It's hemophilia, bleeding disorder. It's X-linked. That means it will be more affected in male or females.
Male.
Why?
Male.
Why?
Because it has only one.
Because one copy.
Only one X. If it's affected, then it will be more in males. But even females, because they have two X's, even if they have one X affected, It's rarely affecting females, okay? It's caused by abnormality or deficiency in factor 8. Okay, so it's hemophilia A or classic hemophilia. It's 85% of the cases. It's factor 8. 15% of the cases, hemophilia B, it's called Christmas hemophilia. It's about factor 9. So either factor 8 or factor 9. If factor 8 is called hemophilia A or hemophilia B if it's factor 9. Okay. Some of them, which is type C, it's due to factor 11, and it's autosomal recessive, not X-linked. Okay, but this is a very rare type. It's less than 5%. So most common one is hemophilia A, which is due to factor 8 deficiency. طبعا زي ما قلت لكم, please remember both Roman numerical and also the number. Just in case of the exam can be both any like factor 8 written 8 or this Roman numerical. Bleeding in hemophilia can be varies in severity, okay, but bleeding mostly in where? In the joint, okay, so it's called hemoarthrosis, bleeding in the joint, but it's depending on the genetic deficiency. And the therapy is what? To get the purified factor, whether it's factor 8 or factor 9. So the affected factor. And factor 8 has two active forms, the large molecular one, okay, and the small molecular one. The smaller part is called classic hemophilia, while the smaller part is classic hemophilia. The large one is von Willebrand factor, okay? And this will give rise to von Willebrand disease, okay? Von Willebrand factor, we said, explained at the start of the lecture, promote the platelet adhesion if there is any injury. Von Willebrand disease, loss of this Willebrand factor will lead to what? There is no von Willebrand factor. There is no platelet is going to stick and adhere. There is no platelet plug. There is no clot. Okay, so it will lead to a bleeding disorder. And it can be either congenital or acquired loss of von Willebrand factor. Okay, treated with what? With desmopressin. This medication will stimulate the von Willebrand production. Okay, this is the platelet abnormalities. Platelets always is either problem with the function of the platelet itself or a problem with the number. If the function is affected, then it's called thrombocythemia, caused by lack of the protein normally present on the platelets of on the surface of the platelets, okay? And then as a result, bleeding will happen. But bleeding from thrombocyte abnormalities is not the bleeding we explained, like the bleeding we explained earlier, hemophilia. Hemophilia is heavy bleeding, dangerous bleeding happen inside the joints, for example, while here is thrombocyte, so it's gonna be what? Thrombocyte will affect the capillaries mainly, so or subcutaneous. So bleeding in the capillaries, small venules or capillaries rather than large vessels. So hemophilia bleeding in the large vessels, while small hemorrhage is thrombocyte. So usually when you see this petechiae, or if it's bigger, it's called purpura. This is a sign of bleeding related to the thrombocytes, but not for example, clotting factors such as hemophilia. Okay, so a smaller hemorrhage, usually in the body or the skin, petechiae or thrombocytic purpura. If it's the number affected, then it's called thrombocytopenia. So low number, we said normal from 150 to 450. So low number of platelets will give rise to thrombocytopenia. If it's less than 30, okay, this will increase the risk of spontaneous bleed. Okay, bleed might happen. Serious if it's the patient going to have surgery. And if it's less than 10,000, then this is not compatible with life. It's frequently lethal. Okay, but remember always thrombocytopenia or thrombocythemia, there is no deep bleeding. It's bleeding from the small hemorrhage or the small capillaries. طيب, what is the major causes of thrombocytopenia? Why is thrombocytopenia happen? What will affect the platelet? Platelet production from where? From the bone marrow, from the megakaryocytes. If there is a problem in the bone marrow, if there is infection, sepsis, or any myelodysplastic disorder, then this will affect the platelets. But the most common one, actually, it's the last one, it's the idiopathic thrombocytopenic purpura without known cause. Okay, this is the most common cause of thrombocytopenia. But if there is decreased production or increased destruction by antibodies as immune thrombocytopenia, increased destruction can be by antibodies or by sequestration, pooling of the platelets, or the platelets going to the spleen, okay, and lead to splenomegaly. This also will lead to thrombocytopenia because it will be increased destruction. Or it's diluted because, for example, if there is massive transfusion or fluid resuscitation, then this will get the number of platelets low. Okay, but the most common one, and you can see it, is idiopathic thrombocytopenia. The patient will presented with what? Small bleeds. So bleeding while brushing teeth, petechiae, purpura, subcutaneous bleeds, small bleeds around the body. Okay. The most common cause is idiopathic one. And the treatment depends on the cause, okay? If it's fresh blood transfusion, if it's due to destruction or a decreased production, splenectomy if it's due to sequestration. So it's according to the cause of the thrombocytopenia. It can also, for idiopathic thrombocytopenia, what they give, or immune also, they give glucocorticoids. So the opposite of bleeding is hypercoagulability, okay? Hypercoagulability results in DVT, BE, all of this stuff. So state of formation of blood clot inside the blood vessel. If it's arterial, okay, due to what? Atherosclerosis, roughness in the endothelial surface, infection, trauma, all of this, arterial. It can be arterial or it can be venous when there is stasis of the in the blood. Stasis in the blood, like the case of this week when there is a prolonged recumbency. So a prolonged sitting in bed, this will get the blood flow slower, and this will activate all the process of thrombin and all the procoagulant, okay? And it will not be washed away quickly when the blood flow like normal activity. Other causes, thrombocytosis, increased platelets, the opposite of thrombocytopenia, or inherited deficiency of antithrombin 3, protein S and C, and also some medication. Cancer itself, cancer is a risk factor for DVT by itself, and medication of cancer is tamoxifen. It is very well known for risk factor for having hypercoagulable state. Last one is DIC, disseminated intravascular coagulation. سمعتوا فيها سابقا ولا أول مرة تمر عليكم؟ Okay. DIC, when there is multiple clots everywhere in the body, it's showering, okay? So it's a very difficult situation. It can happen sometimes when there is infection, cancer, some common pregnancy complication. If there is intrauterine fetal death, the fetal died inside the mother. One of the common, it's not common, but I mean very fatal complication is DIC, okay? Disseminated, from the name disseminated means like it's all around, all over, intravascular coagulopathy. Okay. When there is lots of clotting, then all the clotting factor will be overused. The opposite, what will happen? Overuse of clotting factor, you will have the opposite, bleeding. So after this clotting factor gets confused, then we will have excessive bleeding either internally or externally. Okay, so it's process, it's disorder that have both too much clotting and too little clotting due to the consumption of these factors. Okay, this is the test you're gonna have during also your hematology lab. Bleeding and clotting time. We said bleeding time. Bleeding time is the time from the time of injury until the stop of the bleeding, okay? But without formation of the blood clot. So bleeding time without formation of the blood clot. So you will injure yourself and then you will take the blood by a filter paper, okay, until the stoppage of blood. Why the blood is stopped, for example, after 4 minutes? And you cannot see a clot yet. Remember the steps of the hemostasis I explained? Excellent. It's the formation of platelet plug who stop the bleeding after 4 minutes. And it's called the bleeding time. So it's testing the function of what? Platelets or clotting factors?
platelets.
Excellent. So it's teaching the function of the platelets. So it's gonna be abnormal where, in which disorder? Disorder related to the platelets or disorder related to the clotting?
Platelets.
Excellent. So either a problem with the function or a problem with the number. Okay, thrombocytopenia or thrombocythemia when there is abnormal platelet function. Okay, clear? This one. So it's a bleeding time, a stopping of the blood without clot formation. But if I waited until the clot formed, but we're gonna do it in a different way in the lab. So there is a clot, so it's a clotting, it's called clotting time. The time needed to formation of the clot in vitro. So I will make the injury, start the stopwatch, take a big a drop of blood on the slide, okay, and then I will test with the um, um, syringe. If there is, I will wait for the fibrin thread. Every now and then I will put the syringe and try to get to look for fibrin thread, mostly after more than 8 minutes. So from 5 to 10 minutes, you can see the fibrin thread, and you're gonna do it inshallah practically in the lab. But this is testing what? Platelet function or clotting function?
Clotting.
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 Okay. From the name, it's testing clotting function. So what is the disorder? It can be abnormal.
Hemophilia.
Excellent. Hemophilia and vitamin K deficiency, von Willebrand disease. Okay. Very important, very essential, common question everywhere. Okay. Detailed needed for mostly OSCE and also research essay questions. Okay, very common one. So don't get confused. Try to focus on it in the lab, know the difference, know the normal value, and know the example of each one. Okay. Modifiers, blood thinner. We come across all of this. Okay. Any question? Is it clear for you?
Yes, doctor.
Okay.
يعطيك العافية دكتورة.
يعطيكم العافية جميعا. Thank you for your attendance ونشوفكم على خير بإذن الله في هيماتولوجي لاب 1 بإذن الله.